Thanks to support from ECHO, the Humanitarian Aid Department of the European Commission, CARE International's emergency medical aid was able to reach 19 hospitals and clinics inside Gaza during the crisis in January. Even before the recent crisis erupted in Gaza, medical supplies at emergency clinics were running low. More than 250 drugs were unavailable inside this isolated enclave. A strict blockade imposed on the Gaza Strip since June 2007 had prevented goods and spare parts from reaching Palestinians who live here. In very difficult circumstances, CARE staff rose to the challenge. During 3 weeks of sleepless nights and anxiety-filled days, CARE distribution teams managed to sort truckloads of medical aid in local warehouses and deliver supplies to hospital patients at the height of the emergency. CARE staff used home faxes to coordinate with vendors and dispatch medical supplies as quickly as possible to where they were needed most. CARE staff also made sure that fresh food baskets funded by ECHO reached hospital patients and their families too. Mamdou Mataja, one of CARE's project managers in Gaza, remembers delivering essential drugs to 2 hospitals just hours after the wounded started arriving on December 27th. He told us that the medics were amazed and shocked to see CARE so promptly. They tore open the cartons of supplies and put them to immediate use. He said CARE unloaded trucks through the night. His family was worried and would wait up for him to come home night after night. He felt shaky, stressed and very scared, but he had no choice and he was very glad to give a helping hand to thousands of people. For Al-Auda Hospital in northern Gaza, medical supplies were critical to ensure health services for the 300,000 people who live in Jabalia refugee camp. Dr. Yusuf Musa heads a volunteer doctors association, the Union of Health Work Committees, which oversees Al-Auda Hospital. CARE has partnered his NGO for 7 years, and Dr. Musa told us how impressed he was by CARE's brave and resourceful staff. CARE staff managed to bring in bandages, syringes, blankets and pillows for 500 Al-Auda patients who were injured at the start of the crisis. Dr. Musa said, if CARE had not stocked us up with 3 months of supplies, we would have had a huge problem. Low-cost antibiotics for the needy, bottles of IV fluids, syringes, sterilisation equipment, cleaning supplies, hospital gowns, mattresses, sheets and blankets all were provided by ECHO and CARE. Drugs for acute paediatric infections and diseases like diabetes and hypertension were also rushed to health facilities so that the treatment of chronic patients in Gaza could be sustained. Supplies also quickly reached Al-Quds Hospital in the Tel Al-Hawa neighbourhood of Gaza City. Dr. Walid Ramadan recalled how after a bombardment the second story caught fire and 3 premature babies were evacuated in their incubators while 40 other patients were wheeled to safety. Medics put 2 or 3 people at a time on a single hospital bed and pushed them down the street for half a kilometre away from danger. Bedding provided by CARE and ECHO kept them warm through the chilly winter night. Within 5 days, Al-Quds Hospital, despite losing ambulances, was able to reopen. Because of the continuing blockade, broken windows at Gaza's hospitals have not been replaced with glass yet, but plastic sheeting and duct tape keep the elements at bay. CARE and ECHO have provided this too.